Okay, we got 12 coming in. If a patient is just finishing up a statin-associated myopathy issue, what should you do to follow up, kind of? Right, recheck their serum creatinine kinase level and restart if normalized. Hungry bone syndrome is secondary to what? Decreased parathyroid levels. All right, if you have a patient with cardiogenic syncope, what do you want to do with them? How do you manage? Admit to telemetry unit for echocardiogram and observation. If you have a patient with Barrett's, what do you want to do? Yeah, follow them up. Repeat the endoscopy in about 3 to 5 years. So you have a patient that has had gross hematuria after an acute upper respiratory infection. What should be the first thing on your differential? IgA nephropathy. What p-value suggests statistical significance? A p-value less than or equal to 0.05. A factorial study uses what? More than or at least 2 interventions. If a kid needs life-saving if a kid needs life-saving treatment, but the parents are refusing, what should you do? You treat that child. You treat that child, doc. If you have an initial concern for ADHD in a child, what should you be recommending as a treatment option, first line? Recommend parent and child behavioral therapy. Before starting stimulant therapy for ADHD, what should you do? Get a cardiac history and a physical exam. Definitely. So if you have a child or a patient that's maxed out on stimulant medications for ADHD, what should you do then? Right, get atomoxetine or an alpha-2 adrenergic agonist. True or false? Patellofemoral pain syndrome is a subacute process that is poorly localized. That's true. Note that an RHD negative mom may need the anti-D immunoglobulin. How do you treat pediatric sepsis? With ampicillin and cefotaximine. What syndrome is Torsades de Pont associated with? Long QT syndrome. So someone with long QT syndrome, when they get a bradycardia, that can turn into Torsades de Pont. How do you treat Torsades de Pont? IV magnesium sulfate. And then note that the second line treatment of Torsades de Pont is a temporary transvenous pacing device. How do you treat clindamycin? How do you treat bacterial vaginosis with clindamycin, right? If a patient has symptomatic bacterial vaginosis, should you treat them immediately? Definitely yes. How do you treat primary ovarian insufficiency with estrogen therapy? So some parents bring their kid in and they have some strange story. What should you suspect? Shaken baby syndrome or an abusive head trauma. And what should you look for on physical exam? Retinal hemorrhages. So if you suspect shaken baby syndrome, like any sort of emergency situation, do your ABCDs, right? Then get the CT scan of the head. If some mother is pregnant and she's, not eating her recommended supplements, what's the baby at risk for? Neural tube defects, right? FYI, you need to know the Medicare parts. There's A, B, C, D. A is what? Inpatient and SNFs/hospice. B is what? Outpatient and preventative care, observations and follow-up stuff. C is what? private insurance, and these what? For drugs. Alright, if you suspect brain death, what do you want to do? Perform an apnea test. If you see a black dude and he's having these bumps on his face where his beard should be, what should you suspect? Suspect that they're secondary to shaving and stop the shaving. You need to know the baby milestones. You just get a chart and look it over one day before or whatever. But just note that babies should be walking in about 1 year old. So 9 months to 16 months, somewhere in there. What is obesity in a child most likely due to? Overeating. If a new screening test is showing that there's longer term survival, what sort of bias should you consider? Lead time bias, right? If you have a pregnant mother while you're on OB-GYN and you see a maternal serum alpha fetoprotein increased, what sort of imaging should you do? Amniotic ultrasound. How do you treat Wernicke encephalopathy? With IV thymine. Wernicke encephalopathy / Korsakoff syndrome is due to issues with what brain area or region? The mammary bodies. If a patient gets stung and that leads to wheals, what do you want to give them? Intramuscular epinephrine, right? A Glasgow Coma scale score less than or equal to 8 indicates what activity needs to be done, that they need to be intubated. True or false? Topical antibiotic use can cause what? Allergic contact dermatitis. Is a patient that has, typically a kid, a febrile seizure, are they at risk for more? Yeah, they are. Should you report near-miss errors? Yes. What are the main types of cranial hematomas? Well, whatever. But if someone has a cranial hematoma, you need to monitor for caput secundum, and that should resolve in about 3 days. That is one of the things to be aware of. Patient with HIV not on treatment. How should you treat? Antiretroviral therapy. After 6 months of antiretroviral therapy, what is a good indication that it is working? If there's less than 50 copies of virus per milliliter. Alright, here's a key fact. Listen up. Key fact coming in. Key fact. Only RHD negative moms risk their babies to hemolytic dysfunction. So if it's an RHD positive mom, nothing to worry about. Keep your Rogram. But if it's an RHD negative mother, bring the Rogram out. And I'm out.